So good morning, this is case report part 12. I have many anterior segment cases in this one and quite a few posterior segment cases. This is a 25-year-old woman. She was operated with ICL, intracorneal lens. The IOP is 45 millimeter mercury in the OPD. What is the cause? So look in the biometry. Do you see something which is striking, which could explain the high IOP of this young woman? Well, the axis length. Look at the axis length. It is 16.8 millimeter on the right and on the left eye. So this is a microphthalmos. This is a typical length of an eye if you are a baby. So the cause for the IOP increase is the implantation of an ICL in a very small eye, resulting in an angle closure glaucoma. So the removal is the plan of ICL and phaco IOL. Which IOL is required? Well, let's have a look at the biometry. So you see required is actually a 45 diopter IOL. Well, the IOL with the highest diopter available was this one. This is from Alcon, an IOL with 40 diopters. There was nothing else available. So now we come to the surgery. So this ICL is placed on the nucleus. So we have to remove this ICL. You can cut it in two, even better in 3 pieces, and remove it then with a forceps. I'm using here scissors from Medin-Ural, Russia. Yekaterinburg, a very nice company. So now I'm cutting this IOL in 2 pieces and removing it with a serrated jaws forceps. The next step is, of course, a phaco emulsification. This eye is 60 millimeter long, so it's a very short eye. IOL. The burst of refraction was 5 diopters. We come to case 2. The planned cataract surgery is planned. The pre-op refraction is plus 4 diopters on both sides. Let's look at the biometry. We have an axis length of 21 millimeter and 21 millimeter on the left side. It's important to note that this was performed with an A scan and then inserted into the IOL master machine. 1.5 later, the patient visits an optician because the visual acuity is bad since cataract surgery. She wears no glasses, the lady. So look, these are the measurement of the refraction. She's very myopic. Why is she so myopic? She was referred to my hospital for further evaluation. Visual acuity on the right eye was 0.03 and on the left eye 0.1 without refraction. He has no glasses. Now comes the refraction is minus 7.5 on the right eye and minus 3.5 on the left eye. So the pre-op refraction was plus 4. The post-op is minus 7.5 and minus 3.5 spheric diopters. How could this happen? Let's look at the biometry. This is the old biometry on the left side. and new biometry on the right side. And there are huge differences. Just look at the axial length, which is much longer on the new biometry, and look at the IOL, a huge difference. So axial length is wrong. So why are there so different axial length in the old and new biometry? Well, the nurse measured the axial length with an A scan. She pressed too hard against the cornea, resulting in a too short axial length. Correct was 23.5 and wrong is 21.5. Well, this is interesting. Fundus finding during vitrectomy. What is your diagnosis? This is an asteroid hyalosis. Asteroid hyalosis, which disturbs the patient. Case 4. What is this interesting finding? During vitrectomy, I did something special to the retina. What do you think is this? Well, this is a continuous laser. This is an eye with diabetes, and I performed a continuous laser. Case 5. What is the pathology here? During vitrectomy, I'm just injecting perfluorocarbon. Yes, this is a giant retinal tear, which is more than 3 clock hours. Then it is a giant. Case 6, this is also the last case for today and for the series. What is pathological or not pathological in this eye? What is your diagnosis? Well, these are choroidal vessels in a Scandinavian patient. The fundus is normal. Thank you very much.